Hi, my name is Dr. Bill Owens, and thank you very much for your interest in learning more about chiropractic research. I have a paper here that I'd like to share with you. And the title, this was published in Family Practice in 2012. So again, every bit of research that we use is cutting edge. It's stuff that's hot off the press. And this is what we're reviewing and constantly sharing with the medical community as we educate them about what chiropractic can provide. But this was a very interesting article in the sense that, well, from a title sense, will shared decision making between patients with chronic musculoskeletal pain and physiotherapists, osteopaths, and chiropractors improve patient care. So what the family practice people were really looking at is if everybody's communicating better together, do we get better outcomes? It's really, the research is showing over and over and over again that the time has come where we really have to work together. And if you embrace that while you're staying true to chiropractic, you can build a huge practice for yourself that is not dependent on any sort of marketing at all. And that's certainly what I've done in the doctors that I consult, we've done. But the chronic musculoskeletal pain situation, even though from a chiropractic philosophy we're not chasing pain, the reality is that it's pervasive. There's three main reasons that a patient will seek care from a primary care doctor, their primary care doctor. That's either a cardiovascular complaint, high blood pressure, high cholesterol, things like that. Diabetes, type 2 being the most common. And then 3 is a musculoskeletal problem, and especially chronic is a big chunk of that. So the management of these conditions hasn't not necessarily gotten better on a global scale, and I think that one of those reasons is that we're not working together as well as we should. So how do we use this research to bridge the gap between what we're doing as chiropractors and what family practice docs are doing? This type of approach has been so successful, as a matter of fact, that our local family practice association is reaching out to have a combined meeting with the local chiropractic association to discuss this. Never in the history of organized medicine and organized chiropractic from a grassroots level have we seen this, and it's very encouraging. I'm going to be sharing more with our clients about that, those types of meetings. But I would like to read a couple things here. They state that a shared decision-making approach is likely to be the most appropriate for long-term conditions. We know that if you have heart disease or you have diabetes, you're going to have some sort of medical management for the rest of your life. For chronic musculoskeletal conditions, it seems that those patients have been, once they reach a maximum in improvement, they're let go, and they're abandoned in our healthcare system. We wouldn't do that with a hypertensive patient or somebody with a cholesterol of 400 or somebody that had uncontrolled diabetes. So we really shouldn't do it with the musculoskeletal patient. And this paper is pointing that out. You know, we've known that for 116 years, but now there's actual research. So the conclusions of the paper: seeking care for any condition is not static, but a process, particularly for long-term conditions such as chronic musculoskeletal pain. It's a process. People move in and out of their symptoms. They may be willing to live with a 4 out of 10, but as soon as they're a 7 out of 10, they seek care. Then once they're a 4 out of 10, we believe that they've gotten better, when the truth is they've just regressed to a point where they're tolerable. So in conclusion, and this is where I really take the most meat out of this study, training and support for both health professionals and patients may be helpful in facilitating a shared decision-making approach. From a provider to a provider, chiropractic to family practice, this says it all. This paper was immensely important in building relationships, and it will be for you too. So if you have questions on this, or there's any way that I can help, please feel free to email me, and I'd love to talk to you more about this. Thank you.